Hi everyone, my name is Biane Valdez, and I will be explaining the 5 main concepts of the peaceful end of life theory, according to Dana Hansen, Cornelia Ruland, and Shirley Moore. The first main concept is being free of pain. So pain is an unpleasant sensory or emotional experience. So therefore, being free of pain means being free of the suffering or symptoms of distress the patient is experiencing. So being free of pain is a central part of many patients' end-of-life experience. We can aid in this by monitoring and administering pain relief, including pharmacological and non-pharmacological interventions. So this means administering medications, and non-pharmacological interventions can be keeping the patient comfortable, which will we be explaining later. So the next one is experience of comfort, which means we want to relieve our patients of any kind of discomfort. This can be done by means of prevention, continued monitoring, and relieving physical discomfort with rest and relaxation. So you want to make sure that the patient is resting comfortably, that they're sleeping well, that they're not experiencing their symptoms of suffering and distress. Number 3 is experience of dignity and respect. So each terminally ill patient is respected and valued as a human being. Personal worth, as expressed by the ethical principle of autonomy or respect for persons, which states that individuals should be treated as autonomous agents and persons with diminished autonomy are entitled to protection. So this also means including the patient as well as the significant others or family caregiver in decision making, and being attentive to patients' expressed needs, wishes, and preferences. So we want to make sure that the patient is as autonomous as possible in providing and expressing their needs, and that we as caregivers and as nurses are delivering that for them. Number 4 is being at peace. A peaceful state includes physical, psychological, and spiritual dimensions. So it's important to inspire trust with the patient and the family. This entails emotional support to the patient and family and providing significant others and or caregiver guidance in practical issues. So going back to pharmacological and non-pharmacological interventions, you can also, to keep the patient peaceful, you can administer anti-anxiety medications to keep them calm, because end of life can be anxious. It can lead to some anxiety of the unknown. And also keeping a calm environment. So maybe decreasing the stimulation in the room can be a way of keeping the environment calm. The last one is being close to significant others. And so this one is really important because you want to facilitate participation of the significant others and or caregiver in the patient's care. So you want to let them know what you're doing, ask them if they want to participate, because you want to keep them in the known as much as possible so that they're not devastated, when they do pass. I mean, we want to prepare them as much as possible. Attending to the significant other's grief, worries, and questions just by simply listening or providing resources such as counseling services in a situation where they're experiencing grief to a very extreme extent. Those can be ways that we can provide being close to significant others. So in summary, the 5 main concepts of the peaceful end of life theory are to be free of pain, experience comfort, experience dignity and respect, being at peace, and closeness to significant others. Thank you for listening and have a good day.